Hello, this is a presentation of a small group research project on the topic of autism spectrum disorder at Colorado Christian University. I'm Eric Witt, and I will give an overview of the definition of autism and then briefly explain why the topic is relevant to the counseling profession. Kiley Dixon will discuss the relevance of autism to minorities and the influence of socioeconomic factors regarding autism diagnosis and treatment. Holmes will provide an appraisal of how autism is approached by mental health counselors and the treatment methodologies that are applied. Finally, we will conclude with a summary and our suggestions for the best counseling focus regarding cases involving autism. Though there are historical descriptions of autistic symptoms in individuals, the diagnosis of autism as such did not begin until the 1940s with the work of Hans Asperger and Leo Kanner. Autism spectrum disorder, or ASD, refers to a group of social interaction and communication deficits that are combined with repetitive sensory motor behaviors. This combination is required in the diagnosis according to the current version of the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. The disorder is referred to as a spectrum because the symptoms can range from very mildly occurring to a near catatonic state in some individuals. Most individuals require some form of lifelong support. In 2013, the DSM-5 combined the separate diagnoses of autism, Asperger's syndrome, and the pervasive developmental disorder into the umbrella of ASD. There is some dispute about this in the field of autism treatment, as the ends of the spectrum require very different kinds of treatment. Resources might be more usefully applied if these were separated. ASD is early occurring in development, but not often identified quickly. This is due to a variety of factors, such as lack of awareness and training, as well as availability of resources to families. Parents most often initiate early diagnosis as they observe their children struggling. School-age children are often first diagnosed with co-occurring issues, such as anxiety, ADHD, and mood disorders. Adulthood first diagnoses can occur in individuals that are not intellectually disabled but seek help from other comorbid disorders like depression. In 2012, the World Health Organization estimated that 1% of the Earth's population is affected by autism in its various forms. More recent studies indicate that it may be as much as 5% of the population in developed countries. ASD is a biological disorder that has been shown to be 74 to 93% heritable. Though many genetic risk factors have been suggested, there is little proof to date. ASD is caused by early altered brain development and neural reorganization, but so far no reliable biomarkers have been discovered. Diagnosis is completely based in behavioral observation. 50 years ago, ASD was very narrowly defined and thought to be rare. Children were marginalized, and in severe cases, they were often institutionalized. There was little research being performed and almost no public understanding of the associated issues. Since that time, research has increased significantly. Individuals with ASD have been featured in TV and movies. Though the media tends to sensationalize this aspect of some people with ASD, it has still raised public awareness overall. We have discovered just how common the disorder is and what the effects are. This has resulted in a huge increase in education and advocacy for the affected individuals. Behavioral treatments are developing. For school-age children and adolescents, this often takes the form of social skills groups. In adults, treatment is typically limited to addressing the co-occurring disorders, such as anxiety and depression. There has been some success in treating the various disorders through pharmacology, but there are not yet medications that address ASD directly. Most of the ASD research that has been performed has focused on identification. Genetics have not provided answers. Neurobiology has shown promising evidence that ASD is related to developmental overgrowth of the brain, resulting in altered connectivity. Meanwhile, there is a strong need for coordination between healthcare, education, and other services to focus on the needs of the clients and the specific goals of individuals and families. Dr. Temple Grandin, who herself has ASD, has said on the topic of teaching children with ASD, there needs to be a lot more emphasis on what a child can do instead of what he cannot do. Only 25% of adults with ASD and an average IQ live on their own in the U.S. Many adults with ASD can speak, take care of basic needs, and even work. However, most require daily outside support or assistance. Studies have shown that 1/3 of children diagnosed with ASD have shown improvement in adulthood. The need for community support and the previously mentioned need for coordination of services are the primary reasons for counselors to be educated and active regarding autism spectrum disorder. ASD is often difficult to identify without training. The medical profession does not have time and funding to give the help that is needed. Family members are affected by ASD and they have their own issues that need addressed. It is the calling of counselors as compassionate helpers to help these individuals and their family members to work through the issues, growing to support each other for their daily life. Community, familial, and professional support are all key factors in the success of every individual with ASD. To again quote Dr. Temple Grandin, the worst thing you can do is nothing.
The relevance of different cultures and minorities in diagnosing individuals with autism is most considerable in regard to the age of diagnosis. There are two correlating factors that influence the age of diagnosis of individuals with autism: the disparities in the diagnostic physician and access to consistent medical care or a medical physician. Research supports that there are disparities among diagnoses of autism in African American children and Caucasian children because of the type of diagnostic physician, whereas individuals with access to appropriate diagnostic physicians, such as a psychologist, may be diagnosed earlier than the individual who only has access to a primary care physician as needed. Research also supports evidence that the delayed diagnoses among minority cultures could certainly be attributed to the type of physician making the diagnosis. A primary care physician does not generally specialize in making autism diagnoses due to the realm of knowledge that is required to make an actual autism determination. A study conducted by Emerson found that 1 in 5 Caucasian children were diagnosed by a primary care physician, whereas in African American children, the number was 1 in 3 diagnosed by their primary care physician. There are numerous socioeconomic factors that distinguish treatments and level of care received by the individual with autism, one being a consistent source of medical care. So we talked about the importance of a consistent source of medical care to make a diagnosis, but also to be able to monitor the child and refer the child and family to specialists who can help them with treatment and other things for the individual with autism. So their research found that there were several barriers of families for lower economic status that just increased the difficulty obtaining services with specialists. One of them being financial difficulty, increased likelihood of financial difficulty. Obviously, someone who has insurance or who has access to these resources is a little more apt to be able to meet the co-payments and meet with specialists regularly to receive the services that they need. Another barrier to treatment was the additional time off for all of the extra appointments that the family would be required to go to for the individual with autism spectrum disorder. So not only the diagnoses, but then follow up with treatment with the specialists and then various therapies that may come. Childcare was also another barrier to receiving services due to obvious reasons. If you are taking care of one child with special needs and you have other children, not only are you missing work, but you don't have childcare for them. Thus, evidence supports that poverty level does directly affect the diagnostic age compared to wealthier children, because families of lower socioeconomic status are less likely to have a regular source of medical care and to receive medical supervision. Counseling services are provided to support both the individual with ASD as well as their families. Research has been established by various community outreach support service organizations that just support evidence that minority families, and specifically parents who receive some level of parental advocacy or support, experience significantly decreased levels of stress and parental strain. There's also support services that decrease as individuals transition from adolescence into adulthood, and the opportunities for socialization decrease after transition from the education system into adulthood. So there are several benefits to counseling for the individual with ASD, the primary one being a social outlet in a safe environment. So the individual is able to develop those social skills, continue to develop those social skills that may have been started in the education system. The next is the ability to pinpoint the individual's desires for the future. So, in a safe environment with a trusted companion, such as a counselor, the individual would be able to explore themselves and their ideas, maybe possibilities for the future. And with it being in a safe environment, the individual would feel better about exploring those options. And the third is to facilitate the transition period from adolescence to adulthood. So Thompson did a study where he interviewed several families and parents of individuals with ASD, and one of the primary focuses for counseling was to facilitate the individual with the understanding of the world around them, as well as the transition period that was happening from the adolescent stage to adulthood.
The role of counselors in assisting clients and their families with autism is very important. Counselors should first be sure that the family of the client is aware of the misconceptions about autism so that they can better continue to support their loved one at home. This day and time, social media, movies, and other sources of entertainment have a large impact on our perceptions. For example, many people believe that children with autism are geniuses, don't make eye contact, or show affection. Having perceptions like these could potentially be harmful to an autistic child or adult. It is very critical for families to understand how autism affects their loved one in particular. Many people also believe that autism can be outgrown. However, autism is a lifelong disorder that can be treated, but early intervention is imperative to ensure clients live the best life possible. Needs and wants are no different for children who live with or without autism. Autistic children also want to learn and be understood. For counselors and the family of the client, understanding the needs, wants, and strives of the client can be helpful to individualize goals for improvement. Identifying the strengths and limitations of the client can also assist the counselor in setting goals critical to improvement. Moreover, recognizing limitations of the client can be used as strengths to set healthy goals as well. Interventions and therapies for autism spectrum disorder. Educational intervention is one of the most vital interventions conducted by a counselor. Counselors should work with families and clients providing family interventions, classroom guidance sessions, and meetings. Counselors should continue to provide as much education as possible, as this will be critical to further positive development. Social skill intervention involves social skill, logical, sequential, and communication training. This intervention may be conducted in a group format with siblings or other family and friends. Cognitive behavioral individual counseling is usually done with children with a higher functioning autism spectrum disorder. Usually these children require one-on-one assistance to reduce emotional explosiveness or anxiety. Behavioral interventions can be highly beneficial to a client. This intervention is most widely used because most children with autism have behavioral complications. Medical intervention can also be beneficial. Today there has been no medication found effective in reducing or eliminating the symptoms of autism. However, there are medications that can reduce the specific related symptoms, such as depression, anxiety, and OCD symptoms. Every client is different and may be prescribed different medications depending on their specific needs. Counselors can be helpful in providing encouragement for the client to continue the use of prescribed medications. Occupational intervention can be used to decrease anxiety and increase motor skills. A counselor can be a great support to families, working to assist the occupational therapist or physical therapist with their regimen by conducting different sensory therapies. Relationship development intervention is a family-based intervention geared toward establishing empathy and overall motivation to engage with others. This intervention also works well for adults with autism to practice using eye contact and/or dialogue. There are many different types of therapies for autism spectrum disorder. The type of therapy best suited depends on the specific needs of the individual. However, applied behavioral therapy is the most common. Most autism interventions have some basis of applied behavioral analysis. An afternoon of detention for displaying bad behavior in school is a good example of using applied behavioral therapy. Verbal behavior therapy instructs children who are nonverbal how to communicate with intent. Children learn to use words to get their response they want. Often, children with autism will say one word to get their point across. For example, they may say milk instead of I want milk. Verbal behavior therapy helps children learn to communicate with a purpose. Cognitive behavioral therapy is one of the oldest therapies used. Children with milder symptoms of autism often use this type of therapy. Other therapies focus on improving and developing skills the child already has. Children learn to think positively and find ways of coping instead of succumbing to fear and anxiety. Developmental and individual differences relationship, also known as floor time, this therapy allows children to engage in activities they enjoy while also motivating them to engage with the other people around them. Treatment and education of autistic and related communication handicapped children is a therapy customized depending on the child for social and academic development. This therapy is mostly conducted in a classroom setting. Social skills groups allows children to engage in real-world difficulties with peers. This therapy is not one of the most recommended because children with autism usually have difficulty communicating with their peers. In a social skills group, counselors will set up a real-life group difficult situation and observe how the patient reacts. This also gives the child the opportunity to practice interacting and communicating with others. Many people refer to autism as a family disorder because sometimes the family becomes just as stressed as the autistic child, if not more. Often parents become so focused on their child's needs that they neglect themselves and their own health. Unfortunately, this may stress out the autistic child and other members of the family as well. Researchers recommend that parents and other family members use acceptance as a stress relieving source. Proverbs 3:5 says, "Trust in the Lord with all of your heart and do not lean on your own understanding." Accepting that God has a plan for the child and letting go of expectations are key. Parents may become too worried and stressed that there is no hope for better outcomes with their child, but doctors recommend focusing on the present and where the child is right now to combat stress. Researchers found that parents that are highly stressed have more trouble following the recommendations of counselors and doctors at home. Below are a list of resources a parent might use to implement self-care. Respite care is the idea of taking a short intermission from parenting duties. Some parents may just need a short vacation to relieve their stress. Parents could also benefit from support groups, such as Positive Adult Development. In this group, parents are encouraged to explore their feelings of worry while also using these feelings to use their strengths, such as compassion, empathy, and gratitude to combat stress. The mindful group focuses on deep breathing, yoga, relaxation techniques, and other exercises to combat stress and relieve tension. There has been a recent study on both groups, and parents felt significant change in stress and anxiety after 2 weeks of treatment. Both groups are parent-led support groups. One last stress-relieving tactic is the best in my opinion, and that is to be prayerful and keep smiling. And we know that for those who love God, all things work for good, for those who are called according to his purpose. Romans 8:28.
In conclusion, autism is a complex behavioral mental health disorder that affects 3.5 million Americans and 1% of the world's population. It is unclear what genetic factors play a part in causing this disability. However, early detection and intervention is critical to a child's healthy development. Counseling and therapy have been proven to be the most effective method of treatment. ASD can be just as stressful on caregivers as it is for the host. For this reason, Many counselors suggest that caregivers also seek counseling and join support groups to combat stress. Lastly, it is important to understand that illness is one of the harsh realities of life. Above all interventions, we need God's intervention first. God is the master healer, and there is no greater therapy than prayer. Bless the Lord, O my soul, and forget not all his benefits, who forgives all your iniquity, who heals all your diseases. Psalm 103, 2-3.